Okay. Hello, everyone, for a special extra module in MRMS, Medical Research Masterclass Series. Today, we are joined again by Dr. Nino, an epidemiologist with over 25 years of working experience at the National Center for Disease Control and Public Health, NCDC, Georgia. She's also a public health doctoral candidate. She has a master's in public health, and she's a lecturer at TSU and Caucasus International University. And she is a mentor of the Intermediate Field Epidemiology Program, the FELC, at CDC, and she's a highly experienced public health and epidemiology specialist. And as we all know, we currently are going through a possible second pandemic, but we'll discover today with Dr. Nino Buadze if it will happen, a pandemic or something due to Hantavirus. Please go ahead, Dr. Nino.
Thank you very much, Mohammed, for your introduction. Good afternoon, everyone. Today's lecture focusing on the hantavirus outbreak, which has become highly relevant topic and is currently attracting significant global attention. Before, when we are talking about the hantavirus outbreak, measure risk, prevention, and public challenges, shortly I wanted to explain you why it's important. Nowadays, based on during the global situation and from the experience of the last pandemic time, topic of global health and outbreak investigation, one most important, we can say, topic of health promotion and public health and global health. Today, during the lecture, we are focusing on the modern term of public health. So we are talking about the modern challenges we just now have healthcare systems, and in general, we can say World Health Organization. Learning objectives. By the end of the lecture, students should be able to about hantavirus and explain its epidemiological importance. During the lecture, we are talking about the measure environmental, behavior, and travel-related risk factor. We are talking and have discussion about the epidemiological characteristic of this hantavirus, because this hantavirus, this is the most important hantavirus that have that is related to the outbreak and have human-to-human transmission, we can say, characteristic. In addition, we are focusing on the principle of outbreak preparedness and public health response, on preparedness of the One Health. And at the end of the lecture, you have possibility for the listening of the videos from World Health Organization. This is a first briefing from World Health Organization and the process. This is all. Before, when we are talking this lecture about this topic and about this model, I want to explain you shortly about the outbreak history. What happened during this outbreak? In April 2026, the Dutch expedition cruise ship Handas departed from Ushuaia, Argentina, for a long transatlantic expedition road through the South Ocean and South Atlantic. The voyage included remote distances near Antarctica and the South Atlantic island before continuing toward Africa and eventually the Canary Island. On board of ship were 88 passengers and 59, we can say, crew number. Total, it was 147 persons. The passengers came from multiple countries and had been living together for weeks in a close environment with shared cabins, dining area, lounges, and ventilation systems. A few days after departure, one adult male passenger who had spent more than 3 months traveling in Argentina, Chile, and Uruguay before boarding developed symptoms on 6 April 2026. And the symptoms was fever, severe fatigue, headache, multiple muscle pain, and diarrhea. At first, the ship's medical staff suspected common viral illness or gastrointestinal infection. However, over the following day, his condition rapidly worsened, and he developed several respiratory distress and signs of acute lung diseases and pneumonia. On 11 April, the man died on board the ship. This was the moment when the situation became epidemiologically concerning. Shortly afterward, the woman who had been in close contact with him and traveling with him also developed similar symptoms. And over the next days, these women have several symptoms: fever, respiratory symptoms, weakness, and some cases, several pneumonia-like illness. The ship physician noticed two critical epidemiological clues. First, the ship had origin from South America, and we know that South America is the endemic countries for the Andes hantavirus. And second, the cases appeared linked through close contact and were showing unusually several respiratory diseases. At the point, hantavirus infection became major suspicion. While this was happening, the ship was still in the South Atlantic Ocean. Some critically ill patients were medically evacuated during the voyage, and one severely ill patient was airlifted from island to Johannesburg. Johannesburg, this is South Africa, and admitted to intensive care. Around the same time, the female close contact of the first passenger traveling from St. Helena toward South Africa, but her condition was very bad, and she died in Johannesburg on 26 April. What was happening next time? In South Africa, the National Institution for Communicable Diseases collected blood sample and respiratory sample from the patient. Laboratory testing include PCR testing, serological analysis, and genetic sequencing. On 2nd May 2026, laboratory testing confirmed Andes hantavirus. This finding was especially alarming because Andes virus, guys, is one of the very few hantavirus known to be capable of person-to-person transmission. The same day, the event was officially reported to the World Health Organization through the International Health Regulation Mechanism, and they even met the critical World International Notification because the ship was operating on an international road. Passengers represent 23 nationalities. Multiple several illness and deaths had occurred, and there was concern about possible international spread. The World Health immediately initiated international coordination for including risk assessment, contact tracing, laboratory supporting information, sharing between countries, and epidemiological investigation. At the same time, the ship was still traveling in the Atlantic region near Cabo Verde. Later, it was decided the vessel would proceed to the Canary Islands fine, and especially to the port of Tenerife. This is some island in Spain. And where medical evaluation and intervention control operate should be better organized. World Health Organization, I know, Muhammad, I am read now shortly history, and after that we are started presentation. How many people were symptomatic, who had close contact with confirmed cases, and where the widened transmission for occurring. Out of the 147 people on board. Investigator identified 8 cases, including 6 laboratory confirmed infection cases and 3 deaths. That was all, guys, from the history. And now, when we go to the and when we move to the hantavirus public health concern, what we can say? Why is hantavirus a public health concern? Why is hantavirus considered an important public health concern? Hantavirus infection, what just now I am explaining you, are particularly significant because in some cases they can cause several clinical diseases, including serious respiratory syndrome. And just now I am sharing the information about the Andes hantavirus and sheep outbreaks. What was just now in the Atlantic Ocean. Acute lung injury and even death. In addition to the severity of the diseases, hantavirus are zoonotic infection, meaning that their primary reservoirs are rodents. In the context of globalization, international travel, and human mobility, the risk of the spread of hantavirus. And when we are focusing on the outbreak, which just now I am sharing with you, demonstrated the importance of strong epidemiological surveillance, evidence-based risk communication, outbreak preparedness and response, travel health prescriptions, and international public health collaboration. This event also show that even localized infection diseases even can rapidly become an international public health concern if timely response, coordination, and communication between countries and organizations such as World Health Organization are not implemented properly. Key facts about the hantavirus. Hantavirus are a group of viruses carried by rodents that can cause several diseases in humans. People usually get infected through contact with infection rodents or their urine drop or saliva. Infection with hantavirus can cause a range of illness, including several diseases and deaths. We can say endemic diseases for hantavirus. This is South and North America, some Asian countries, African countries, and some European countries. In the American, hantavirus can cause hantavirus cardiopulmonary syndrome, several respiratory illness with the case fatality rate up to 50%. This is a very high indicators, evidence information that once again highlight high risk and negative impact of hantavirus to the healthcare system and health system of human. And this hantavirus, which is now I am explaining, and what was the source of the, but just now we have outbreaks, and this virus found in South America is a currently known hantavirus for which limited human-to-human transmission among contact has been documented. And in Europe and Asia, hantavirus cause hemorrhagic fever with renal syndrome. This is the most important key fact about the hantavirus. Overview: hantavirus are zoonotic diseases because what's the meaning of zoonotic diseases? We can say middle host is animals, yeah, and animals it make a very, very important role in transmission process. So as I mentioned, rodents and rodents immediately make very, very important role and are occasionally transmitted to human. Infection in people can result in several illness and often death. Also, the diseases vary by type of virus, geographical location. In the American, infection has been known the lead to hantavirus cardiopulmonary syndrome. This is complication after the hantavirus. Rapidly progressive condition affected the lung and heart, while in Europe and Asia, hantavirus have been known to cause hemorrhagic fever with renal syndrome, which primarily affected the kidneys and blood vessels. While there is no specific treatment for the hantavirus, and on this direction, important role make early detection and the symptomatic treatment. Because nowadays we don't have specific treatment for the hantavirus, and this is the complications and negative and harm when we're talking about the positive outcome after the hantavirus. Vital family and classification. Hantavirus belong to the family Hantaviridae with the order Baniviridae. Each hantavirus is typically associated with a specific rodent reservoir species, and in which the virus causes long-term infection without apparent illness. Also, many hantavirus species have been identified worldwide. Only limited number are known to cause human diseases. Hantavirus present in, as I mentioned, North, Central, and South America are known to cause of hemorrhagic cardiopulmonary syndrome. The Antis virus is part of this family and is known to cause limited human-to-human transmission among close and prolonged contacts, primarily in Argentina, in Chile. And this ship, which just now I'm sharing the information, that was origin from South America, from Argentina. The trip was started in Argentina. Argentina, this is the endemic countries for the Andes virus. Hantavirus found in Europe and Asia, in addition, are known to cause hemorrhagic fever, and the human-to-human transmission has not been documented in this part of the world. Yeah, we can say. Second module, when we are focusing on the population health indicator. Shortly about this, we are talking on the previous public lecture when I am talking with you about the public health indicators and public health challenges and outbreak investigation and study design. When I'm explaining you this topic. Measuring diseases occurring during the outbreak. You know that we have two types of indicator for the evaluation of health of population. This is a vital statistics that includes and used to describe population health status, and it's involve mortality rate, case fatality rate, and life expectancy, population growth indicator. Just now, when we're we're talking about the hantavirus, we use case fatality rate, and I'm explaining why we use these types of indicator. Another very important groups of indicators, this is a diseases occurrence indicator that used to assess outbreak dynamic. And in this graph involve incidence, number of new hantavirus cases during the specific time period, prevalence, total number of existing cases in population at given time, attack rate. It's very, very important indicator for the evaluation of association between exposure and outcome, and the proportion of exposed individual who became infected during outbreak, and case fatality rate in addition, which is a very, very important proportion of deaths among confirmed cases, and in addition burden of diseases. Yeah, Burden of diseases. What's the meaning of burden of diseases? In addition, this is as we mentioned, this is indicators that involve diseases occurrence indicators. Yeah, burden of diseases describes the overall impact of diseases on population, health, and society, and includes mortality, morbidity, disability, hospitalization, and economic loss. All these factors, it's important for the availability and for the evaluation of access to medical care services, access to insurance system, and other very, very important, we can say, tools in healthcare systems. When we're focusing on the case fatality rate, because during the lecture, I'm highlight a lot of time this indicator, case fatality rate, and I am remind you what the case fatality rate means. Case fatality rate, it refers to the proportion of the deaths among confirmed cases of diseases. It shows among people diagnosed with the diseases how many die from that diseases, and it's very, very important. I think you agree with me, because based on this we can evaluate we can say negative impact of diseases and economic cost of the diseases to the healthcare system. It's very, very important indicator. Based on this, when we are talking about the evaluation and investigation and analyze of this outbreak, case fatality, calculation of case fatality rate of hantavirus is very, very important for the evaluation of negative impact of hantavirus and for the evaluation of risk of the diseases, we can say. We have a burden of hantavirus, what we can say. Also, hantavirus infection are considered relatively uncommon worldwide. They are associated with a very high case fatality rate, which makes them an important public health concern. The severity of diseases differ depending on the virus type and geographical region. Globally, experts estimate that approximately 10,000 to more than 100,000 infections may occur each year, and the highest burden of observed in Asia and part of Europe. In East Asia, and especially in China and Republic of Korea, hemorrhagic fever with renal syndrome remain an important health problem and account for thousands of cases. Unusually, those incidents has declined over recent decide to improve surveillance, rodent control, and public health intervention. In Europe, several thousand cases are reported every year, mainly in northern and central region where Pumala virus circulated, and those infections are often associated with occupational or environmental exposure. One most important characteristic of hantavirus cardiopulmonary syndrome, which is endemic for America, United States, and South America. It's very high case fatality rate. These types of hantavirus have, which commonly range between 20% and 40%, and in some outbreaks may even higher. This is one of the main reasons why hantavirus outbreak attracts significant international public health attention, despite the relatively low number of, you can see, cases. Now, when we go model 3 and talking about the epidemiological characteristic of hantavirus, transmission process. As I mentioned, hantavirus, this is a zoonotic diseases. What means the zoonotic diseases? Vector-borne diseases. That means in transmission process, and you know that in transmission process involve 6 steps, yeah? And the one most important step is, we can say, animals, because animals, this is a reservoir where the infection agents live before they move to the humans. And for the hantavirus, we can see reservoir is rodents. Infection may also occur less commonly through rodent bites. Activities that involve contact with rodents, such as cleaning or poorly ventilated spaces, farming, voluntary work, and sleeping in rodent-infected, we can say, areas. To date, human-to-human transmission has been documented only for Andes virus in the Americas and remain income. When it occurs, transmission between people has been associated with close, prolonged contact, particularly among household member or intimate partner. This is the source of the transmission of hantavirus, Andes hantavirus. It has symptoms and clinical presentation, what we can say. In humans, symptoms usually begin between 1 and 8 weeks after exposure, depending on type of virus, typically include fever, headache, muscle ache, gastrointestinal symptoms such as abdominal pain or vomiting. Diseases may progress rapidly to cause shortness of breath and may include low blood pressure, bleeding disorder, and kidney failure. At lab, when we're talking about the diagnosis, one of the major challenges when we're talking about the diagnosis of hantavirus is that the early symptoms are usually non-specific and resemble many other infection diseases. Patient may have those symptoms: fever, headache, muscle pain, vomiting, and respiratory syndrome. And all these symptoms, we can say, have such as infections such as COVID-19, pneumonia, and other respiratory, we can say, infection diseases. For this reason, epidemiologists' history becomes extremely important. Clinicians and epidemiologists must carefully assess possible rodent exposure, occupational and environmental risk factor, travel history make very, very important role. Based on our history, epidemiologists find that sheep was joined this cruise from Argentina. And Argentina and Chile, this is the endemic countries for hantavirus. This, we can say, information was differential and very, very important for the differential diagnosis of this, we can say, patient from this outbreak, which just now we are talking. Yeah, laboratory confirmation, it's make very, very important role. Laboratory confirmation, such as serological testing to detect hantavirus specific antibiotics such as IgM and IgG, and molecular methods such as reserved transcription polymerase chain, and specific PCR, we can see, which can detect viral RNA during the acute phase of infection. Another important point is biosafety. Samples obtained from suspected patients are considered potentially hazardous biological material. Therefore, laboratory testing must be performed under strict biosafety, biocontamination conduct to protect laboratory person and prevent accidental exposure, we can say. In addition, what we can say, in addition, international regulation requires that non-inactivated biological, we can say, specimen be packaged and transported using the triple packaging system during national and international transport. This became particularly important during the outbreak, sheep outbreak, cruise outbreak, and when supply had to be transported internationally or confirmatory testing and sequencing. Treatment. As I mentioned, we don't have any specific treatment for the hantavirus. Here, one most important, we can say, role make early detection. And providers should be focusing on the maintaining vital function, supporting respiration, and the complication. They should be focusing on the controlling of complication and managing organ dysfunction. In addition, it's very important is specific, we can say, particularly and specific, we can say, treatment for the lung pneumonia, cardiovascular system, and in addition, it's very important oxygen therapy, intensive monitoring, food and hemorrhagic management, and etc. One most important, and we should be highlighted when we're talking about the treatments, that we don't have any guidelines and protocols for the specific licensed specific antiviral treatment. We don't have. Doctors treat specifically and focusing on the symptoms. Symptomatic treatment we have here. Prevention and control. What we can say about this, about the prevention and control. Available evidence suggests that the risk of healthcare associated transmission of hantavirus include this virus. And this virus have most important, we can say, characteristic, and with a close contact transmission from humans to humans. And on this direction, it's very important measure of, we can say, measure of and having evidence information of situation. What includes this? It includes keeping homes and workplaces clean, sealing openings that allow rodents and entire buildings, storing food securely, using safe cleaning practices in areas contaminated by rodents, avoiding dry sweeping or vacuuming rodent droppings, depending of contaminating area before cleaning, and strengthening hand hygiene practices. During outbreak or when cases are suspected, early identification and isolation of cases, monitoring of close contact, and application of standard infection prevention measures are important to limit it, we can say, further spread. When we're talking about the prevention and the control in healthcare setting, what we can say, available evidence base indicates that the risk of healthcare-associated transmission of hantavirus, including antivirus, is very low when appropriate infection prevention and control measures are applied. In healthcare environment, standard precision should be applied for all patients, including hand hygiene, environmental cleaning, and safe handling of blood and body fluid. For suspected or confirmed hantavirus infection, use of standard, we can say, combined with transmission base, we can say, during provision of care is advanced. For aerosol generating procedure, airborne, we can say, should be used precautions. Airborne precaution should be used. Early recognition of suspected cases, prompt isolation, and considering addressing the recommended infection prevention and control measure remain essential to protect healthcare, we can say, personnel. Key, we can say, components when we're talking about the infection control and the prevention. Key measure during a hantavirus outbreak. early case recognition, it's very, very important. Patient isolation, in addition, it's very, very important. As I mentioned, hand hygiene, safe handling and blood and body fluids, it's very important. Environmental cleaning, personal protective equipment, airborne precision during aerosol generate procedure, and protection of healthcare workers. Goal of infection prevention and control, prevent healthcare associated transmission, and protect healthcare professionals, which is a very, very important, because we have very bad history from last pandemic time. When we analyze death rate, mortality rate during the pandemic time, healthcare workers, you find that it was very, very high. It was very, very high because based on not enough, because we can say protection, or we can say equipment, which are very, very important for the protection of healthcare workers. When we are talking about the World Health Organizational response, World Health Organization with countries and partners to strengthen surveillance laboratory capacity, risk communication and community engagement, early detection, patient care, outbreak response for hantavirus infection. This includes developing and updating evidence-based guidelines on diagnosis, case management, implementation of new protocols and recommendation for healthcare workers, supporting to government for the better management of outbreaks and contact tracing. World Health Organization promote integrate One Health approaches that address the link between human health, rodents, and reservoirs, and the environment, and support countries in reviewing emerging evidence to ensure recommendations remain up to date, we can say. Now, when we are talking about the historical epidemiology of hantavirus, what we can say? We can say two major outbreaks in the last century lead to the discovery and recognition of hantavirus. The first outbreak was during the Korea War, during the 1950-1953, when more than 300 soldiers from United Nations was infected from hemorrhagic fever. This is one most important types of hantavirus. Second major outbreak occurred in 1993 in the Four Corners region in the United States, and the diseases was initially referred to as Four Corners diseases and later became known as hantavirus pulmonary syndrome and hantavirus cardiopulmonary syndrome. In some outbreaks, mortality rate reached 12% for hantavirus pulmonary syndrome, up to 6% from hantavirus pulmonary syndrome. In 1978, researchers identified hantavirus, its rodent reservoir that spread field, we can see field mouse. Later, additional important hantavirus were identified in Dobrava virus, Seoul virus, in the, we can say, Pumala virus. When we're talking about the hantavirus circle, what we can say, hantavirus belong to hantavirus family, as we mentioned at the beginning of our lecture. I mentioned, but once again, this is a Hantaviridae family, which includes more than 300 hantavirus. And all these virus infected to animal, plants, human, and arthropods. Hantavirus are commonly classified into old, we can say, world hantavirus and new world hantavirus. This classification belongs to geographical distribution, is again, in addition, rodents reservoir, and the type of diseases caused by in humans, we can say. This is a very, very important, we can say, slides that show us structure of hantavirus. As you see, there we have in three main important segments. S, small segment that is correlated to the nucleoprotein. Second important is M, medium segment that have that linked to the glycoproteins, and the second important segment is L, large segment that is linked to viral RNA polymerase. All three segments are negative sense RNA. Each segment has complementary sequences at the 3 and 5 end, and the 3 segment associated with N protein, 2 from, we can say, ribonuclein, nuclein protein components. Yeah, this is we can see structure of hantavirus. This is measured hantavirus, as you see. Hantavirus, it was identified in 1976 in region Asia. Diseases is hemorrhagic fever, respiratory syndrome. Fatality rate 550%. It's very high. Cell virus, it was identified in 98 in urban area, and diseases, it's hemorrhagic fever, respiratory syndrome. Its fatality rates, it's lower. Pumala virus, it was identified in 98 in Europe, and the diseases is middle countries, hemorrhagic fever, respiratory syndrome, and fatality rate is less than 1. The Brava virus, it was identified in 1919 in Europe, and the Brava virus have a high fatality rate. Sin number virus, it was probably identified in 1993 in United States, and there is very high fatality rate, 30-50%. And on this virus, it was identified in 1919 in South America, Argentina, Chile, Uruguay, and the case fatality rate is 35 and 50%. As you see, most highest case fatality rate have on this virus. And this cruise outbreak, which just now we have, this is source of this outbreak is on this virus. That means it's we can say negative and harm from this we can say outbreak is very, very big, as we can say. When we're talking about the ecological determination of hantavirus, what we can say. Now that we have discussed the structure and the basis characteristic of hantavirus, and when we're talking about the transmission of hantavirus, as I mentioned, transmission is strongly connected to the ecological and environmental condition. The virus is naturally maintained in rodent population, and different these hantavirus types are associated with the specific rodent species. Several important ecological factors can increase the risk of transmission, including rodent reservoir distribution, environmental condition and climate condition, ecological, we can say, disruption, and increased human interaction with national habits. For example, deforestation, climate change, agriculture activities, and human movement into rodent habits may increase opportunity for exposure and transmission, we can say. As I mentioned, rodents is exposure for the hantavirus. key characteristic percent infection, absence of several diseases in rodent, long-term viral shedding, and rodent may excrete the virus through urine, saliva, and feces. In addition, one most important, we can say, when we are focusing and talking about the transmission, spillover transmission of hantavirus that involve human infection represents spillover even from the natural rodent reservoir. Spillover transmission occurs when humans enter rodent habitats, environmental disruption, increased exposure, and contaminated aerosols are inhaled. Environmental drivers of hantavirus emergency, ecological factor, increased transmission risk, as I mentioned, agriculture exploitation, urbanization, climate change, and another factor, rodent habitat, increased rodent-human interaction, and viral transmission among rodents, we can say. As I mentioned, climate change, in addition, it's make very, very important role to the transmission of hantavirus, and etc. When we go to the classification of hantavirus, what we can say? In general, we have two types of hantavirus: New World hantavirus and Old World hantavirus. Now we are talking about each of them. Old World hantavirus. Old World hantavirus are mainly distributed in Europe and Asia. Those hantavirus are primarily associated with the diseases, hemorrhagic fever with renal syndrome, and main characteristic symptoms is fever, hemorrhagic manifestation, hypertension, acute kidney injury, and etc. The severity of diseases may vary depending on the virus type, and compare with New World, and it's very, very important is when doctors focusing on the complication, because here we have a very negative outcome. Yeah, this is a clinical spectrum of hantavirus for the old hantavirus. As you see, important viruses is Hantavirus, cell virus, Dobrava virus, and Pumala virus. Yeah, for the old. And the main important symptoms: fever, hemorrhagic syndrome, renal implication, and acute kidney injury. New World hantavirus. New World hantavirus is distributed in North America and South America. Unlike all the world hantavirus, which are more commonly associated with the renal diseases, New World hantavirus are primarily linked to hantavirus pulmonary syndrome, also known hantavirus pulmonary syndrome, and hantavirus we can see cardiopulmonary syndrome and cardiopulmonary syndromes. And one most important, we can see, symptoms is pulmonary edema, hypoxia, shock, and acute respiratory, we can see, failure. As you see, important viruses as Andes virus, seen a number of virus, and main manifestation is pulmonary edema, acute respiratory distress, cardiovascular, we can say, complication, and high fatality rates, we can say. Yeah, severity and pathogenity. Hantavirus are medically important because they can be cause several and potential life-threatening diseases. The severity depends on the virus type, geographical region, and the patient's clinical condition. One of the most serious complications is several respiratory failure, especially in hantavirus pulmonary syndrome, where patient may repeatedly develop pulmonary edema and acute respiratory distress. In several cases, patient may be develop hemorrhagic, we can say, manifestation, hypertension, and shock, and eventually multi-organ, we can say, failure. The diseases may progress very rapidly, which is of early recognition, monitoring, and suppurative intervention are extremely important for the improving patient outcome, we can say, and for the protection of patient. High fatality hantavirus strains and public health significance. Measure high fatality hantavirus, as we mentioned, and I am showing you just now some table, and the case fatality rate from this virus is 35–50%, primarily defined in South America, especially Argentina and Chile. Seen virus, in addition, the same, we can say, case fatality rate we have here. The main cause of hantavirus pulmonary syndrome in North America. Clinical and epidemiological important. Both hantavirus are associated with the several form hantavirus pulmonary syndrome, characterized by repeat respiratory deterioration, pulmonary edema, cardiopulmonary failure, high intensive care demand. As I mentioned, very high case fatality rate is characterized for on this virus and for seen number virus. This is all these, we can say, types of hantavirus is new world hantavirus. About this we are talking. This is a very important maps, guys, because these maps show us distribution of hantavirus in the world, as you see, and the incidence rate. This is the incidence rate per 1,000, we can say, population. In the green color, dark green, you see more than, we can say, countries who have high case fatality rate. Yeah, for example, here you see that in North America in dark green color, and here is approximately 101,000. Yeah, and light green in Central America, you see that incidence is 0.5 and 620. It's not high. Yeah, so it means endemic countries and countries who have negative and we can say negative economic cost from the hantavirus. This is in North and West America and South America in addition. In the purple, you know that distribution and another types of hantavirus. This is in purple color, you dark purple color, you see the countries who have incidence rate 100,000 and 10,020. In this, we can see period. And in origin, it's we can highlight countries from European countries with other types of hantavirus. In addition, this is a global geographical distribution and epidemiological burden of hantavirus. As you see in the green color, highlighted countries who have high case fatality rate, and from these countries is characteristic types of hemorrhagic fever with renal syndrome, these types of hantavirus. And the blue color is the countries by which characteristic other types of, we can say, hantavirus cardiopulmonary syndrome. Yeah, this is. Yeah, this is a very important table that show us case fatality rate and we can say by the diseases. Hemorrhagic fever with renal syndrome. Affected organ is kidney, spleen, liver, brain, blood vessel, ears, and fatality rate is approximately 1. Its distribution is China, South Korea, Russia, Vietnam. And when we're talking about the hantavirus cardiopulmonary syndrome or hantavirus pulmonary syndrome, complication is focusing affected to the organ, lung, heart, spleen, liver, blood vessel. So as you see there, we have very high case fatality rate, 30 and 50%. It's very, very high. Distribution of this virus is United States, Canada, Panama, Argentina, Brazil, Paraguay, and Bolivia. South and Central, we can see America. Yeah, this is all. And now we'll move to the public health preparedness and prevention, what we can see. Why preparedness matter for the hantavirus? Effective outbreak, guys, prevention and response require coordination, multidisciplinary approach involving epidemiologists, clinicians, laboratories, public health experts, and other, we can say, international organization. One of the most important priorities is early epidemiological surveillance, repeat detection of unusual cases, and timely reporting are essential for preventing wider transmission and initiating outbreak investigation. Repeat laboratory diagnosis is also very, very important for the early detection. And another key component is evidence-based risk communication during outbreak. Accurate and transparent communication helps reduce panic, prevent misinformation, and improve public cooperation with health recommendations. In addition, it's very, very important is intersectoral coordination, multidisciplinary coordination with experts who work with other sectors, and etc. When we're talking about the public health priority during the hantavirus outbreak, effective outbreak prevention and response is one most important, and early epidemiological surveillance, repeat laboratory diagnosis, evidence-based risk communication, international collaboration, information sharing, continue monitoring our epidemiological trends, and community engagement and health education. Now we'll move to the one most important, we can say, topic of our lecture, One Health. What the One Health means? One most important part of global health nowadays. One Health concept recognizes that human health, animal health, and environmental health are closely interconnected, we can say. Hantavirus is an excellent example of this relationship because the transmission circle involves rodents and natural reservoir host, environmental and ecological condition, and human exposure and behavior. In natural rodents maintain chronic hantavirus infection without developing several diseases. The virus circulated continuously within rodent population and may spread between rodents through close contact and environmental contamination. Several environmental and ecological factors influence the transmission cycle include climate, as you see, climate change and weather condition, habit and landscape change, food availability, we can say biodiversity, and rodent population, we can say dynamic. Human activities, in addition, it's make very, very important role. Agriculture, exploitation, urbanization, outdoor activities, and increased interaction with rodent habits may increase opportunity for human exposure. Humans usually became infected through inhalation or aerosolization. Patient contaminated with rodent urine, saliva, and feces. The future also highlights that here you see, yeah, in this infographic, that all these, we can say, factors, we can say environment, humans, rodents, it's make very, very important role to transmission cycles, yeah. And based on this implementation of evidence-based and targets, we can say intervention, when we are talking about the prevention and risk communication, it's very, very important, yeah, according to One Health perspective. Prevention and public health control, always it's focusing on the, we can say, One Health preparedness. And what is this? Rodent control. It's involved reduction of rodent population, safe stroke of food on pest, environmental sanitation, reduction of human exposure that involve avoid of contaminated dust and aerosols, safe cleaning of rodent infected areas, use of protective equipment. In addition, very, very important when we're talking about the prevention and implementation public health control measure, surveillance and early detection. Implementation, electronic system, surveillance system for the early detection. Laboratory confirmation, it's very, very important, and early outbreak investigation. And last, when we're talking about the public health control measure, hantavirus infection, One Health approaches, collaboration between animal, human, and environmental sector, intersectoral and intrasectoral collaboration, monitoring ecological and key climate-related risk factors. All this, we can say, main strategy, it's important for the prevention and implementation of public health control, we can say intervention for the prevention of hantavirus. Yeah, about this we're talking. And now when we're talking about the development of World Health Organization preparedness approaches to hantavirus, what we can say about this? First, very important document that was published, international, we can say, regulation according to hantavirus. It was published in 1999 according to World Health Organization, and developed the first international influenza pandemic preparedness framework. The model focused mainly on pandemic phases. It's in three phases of the pandemic: transmission monitoring and outbreak alert system. In 2005 and 2009, World Health Organization update preparedness guidelines together with the international health regulations, and preparedness model include preparedness phase, alert, limited transmission phase, and pandemic phase. During the COVID-19 pandemic, we managed our pandemic based on this international regulation. Approach focusing mainly on influenza pandemic surveillance, international report, and outbreak, we can see reports. In 2020, COVID-19 pandemic demonstrates the pandemic preparedness requires strong surveillance system, health system, risk communication, international coordination, and ecological and zoonotic risk assessment, One Health assessment. Post-COVID World Health Organization framework is focusing on One Health principle, integrated surveillance, human-animal environmental interaction, healthcare system, evidence-based intervention, and global collaboration. And nowadays, when we're focusing on the in current priorities for hantavirus preparedness and response, It's involved and focusing on the strengthening epidemiological surveillance system, supporting laboratory detection and diagnosis capacity, risk communication and community engagement, strengthens healthcare preparedness and infection prevention, promoting integrated One Health approaches, international collaboration, information sharing, development of evidence-based guides for diagnosis, outbreak intervention, and case management, we can say. In addition, when we're talking about the, when you go and move to our outbreak in 2026, what we can say, World Health Organization response according this outbreak, it's include international, we can say, outbreak coordination, passenger isolation and monitoring, laboratory confirmation, epidemiological intervention, and international information sharing and risk communication and public communication. These are outbreaks demonstrated how localized zoonotic infection can rapidly become an international public health concern requiring coordinating global action. Following laboratory confirmation of Andes Hantavirus infection, World Health Organization activated international coordination mechanisms through the international health regulation framework and work closely with national public health authorities, laboratories, epidemiologists, and international governments. The response includes international outbreak coordination to support communication, collaboration between the countries involved since passengers and crew members origin from multiple nations. Passenger isolated and monitoring were important component of the response, and symptomatic individuals were isolated while close contact were placed under observation and follow and monitoring to identify possible secondary transmission. In addition, guys, laboratory confirmation was also critical in this step. Blood and respiratory samples were analyzed using PCR, serology, and genetic testing and specialized laboratory confirm Andes, we can say, hantavirus infection. World Health Organization World Health Organization and partners of organization also supporting epidemiological investigation activities, including case identification, contact tracing, exposure assessment, and risk evaluation. Another major component was international information sharing. Countries were informed through international public health communication system in order to support preparedness and surveillance activities. Risk communication and public communication were equally important in reducing misinformation and public panic, while providing evidence-based recommendations regarding transmission risk and preventive measures. And finally, Handi's outbreak became an important example of modern international outbreak response, highlights the importance of preparedness, surveillance, laboratory capacity, and global public health, we can say, collaboration. When we move to our outbreak, what we can say, in May 2026, World Health Organization was informed about cluster of several respiratory illness cases aboard the Handi's cruise ship. The first official notification was received through the United Kingdom National Focal Point under the International Health Regulation 2005 system. And this is an important example of how international outbreak alert system function in real time. Once World Health Organization receives a notification, organization repeatedly, we can see, initiating international coordination and began assigns a potential public health risk. World Health Organization worked together with national authors, epidemiologists, public health experts, governments, and initial response activities include epidemiological investigation, contact monitoring, laboratory investigation, and other important, we can say, activities. The main, we can say, public health response measure initiated by World Health Organization and international health authorities after the Hantavirus outbreak was detected aboard the Hantavirus cruise ship. And once the outbreak notification was received through the international health regulation system, World Health Organization repeatedly coordinate with national public health authorities and international partners and investigate situation and assess potential global health risks. One of the first priorities was laboratory confirmation. Diagnostic testing was performed in order to identify the causative pathogen and determine whether the outbreak involved highly transmissible infection diseases. Later, laboratory analysis confirmed on this virus infection. World Health Organization also initiated international information sharing because passenger and crew member were conducted to multiple countries. Repeat communication between surveillance system and national authorities was essential to separate contact monitoring and preparedness activities. And another critical, we can say, component was risk communication. World Health Organization media brings and briefings and public communication effort to provide evidence-based information, reduce misinformation, and prevent unnecessary panic. World Health Organization experts emphasize that also on this virus is a serious infection, the overall public health risks remain low because they don't transmit it very rapidly from one person to another, such as COVID-19 infection diseases. Yeah. Public health perspective, what we can say. From a public health perspective, this outbreak demonstrates the critical components of modern outbreak preparedness and global health security. First, the event highlights the importance of repeat detection, early identification of unusual diseases is very, very important. Second, the outbreak emphasizes the importance of international coordination because the cruise ship involved passengers from different countries. Yeah, and third, the situation demonstrates the value of preparedness system. Modern preparedness includes surveillance capacity, laboratory and healthcare preparedness, and evidence-based outbreak, we can say, response. Yeah, now guys, I want sharing with you this, we can see video. Did you see this video? Guys, did you listen to the video?
Are you sharing that video right now?
Yeah.
Are you sharing that video right now?
Yes.
It's not visible actually. If you can share again.
Okay.
It's not visible. Like
Just a moment, please. Now?
Yeah, it's visible. Yes.
This is a, please listen, please.
Is it supposed to have an audio? Then we cannot hear. Yeah, we will send this link after this because a lot of people cannot hear this, doctor.
You don't listen to video?
Yeah, we cannot hear the video. You can share the link. Maybe they can watch it on their phones because it's not. We cannot hear it. You have to go and share the audio.
This is okay. When I'm sent the later, I'm sent the link. Just a moment. Just a moment. Guys, this is two links. One link, this is a first briefing from World Health Organization. And during the first briefing, General Director of World Health Organization explained to audience what was happened at the beginning of outbreak. And the second link, please listen, second link in the process, yeah, for the information of audience about this outbreak, yeah. Please listen. This is one most important example when we're talking about the communication between the stakeholder, decision maker, governments, and from World Health Organization and population, general population, for the decreasing of panic and for the decreasing of impact of misinformation to the population, because sometimes misinformation very negatively affected to the, we can say, management of and to the solution of the process. When we are continuing, you can listen this video later, and now I would like sharing and continue my this is first and second video, yeah. And in addition, this is a letter from Tedros Ghebreyesus, and it is a very, very important example for the positive and good communication between governments and the stakeholders and decision makers, and between the and a good example about multi-sector, when we are talking about the effective multi-sectoral collaboration. Yeah. And at the end of our lecture, what we can say, what's the key concept coverage of our lecture? You can see we are considered during the lecture, and we are talking about the main important aspects of hantavirus epidemiology. We are talking about the meaning and important role of One Health perspective in modern medicine and especially in global health. We are talking and highlight spillover transmission in of hantavirus, and focusing on the Andes hantavirus, which make very, very important role and negatively affected to the, and have very high case fatality rate. And in addition, we are talking about the global health security. During the lecture, we consider infection and focusing on the infection prevention and control of hantavirus, and consider during the lecture main important international regulation according to hantavirus. And in addition, we'll consider and have discussion about World Health Organization international response mechanism. Yeah, I think for you it was interesting. Thank you for your attention and participation. Yeah, this is all what I wanted to explain you about the hantavirus. I think it will for you interesting and a lots of new information you find during the lecture. Thank you very much.
Thank you so much, Doctor. It was really great session. We have some questions. I think we have Ayush. You can go ahead.
Hello, Ayush.
Ayush, you're not audible.
Hello. Now
Yes,
can you hear me?
yes,
Yeah.
yes, yes.
So, doctor, my question was not specifically related to hantavirus, but more a WHO in general. So, when this everything was happening, we got to know that USA has withdrawn their name from WHO as for January 2026. So, what do you think, like for future such viruses that are being spread by such countries, they might not admit it to the public in general. It might can cause and havoc. Like even this, I don't know. We have been seeing on social media and certain papers as well, where they are reporting that they already knew about the case, but it wasn't disclosed until it became an pandemic within the cruise ship. So, do you think, what do you think that USA not being part of WHO now will affect this sort of pandemics happening again and again?
I think, on my opinion, World Health Organization, one most important international organizations that make very important role to the management of the infection disease, high risk infection diseases, especially when we're talking dangerous infection diseases. Yeah, and coordination between the governments and international non-governmental organizations such as World Health Organization, one most important for the solution of this process. Yeah, what countries have in their, we can say, healthcare system. United States, you mentioned United States, yeah. United States have a lot of financial resources, but we know that infection diseases don't have any border. Yeah, they're spread. And based on globalization nowadays, they're migrated very rapidly. Yeah. And in this direction, coordination and discussion with international organization and working together. And this example, we just now explained you this trip outbreak, it was very good example of international multi-sectoral effective coordination for the solution of the process. And when you want soluted some problems, important is international effective coordination with non-governmental organizations such as ECDC, European Diseases Control Center, United Diseases Control Center, two countries Diseases Control Center, and WHO. Yeah, especially when we're talking, I am highlighted and maybe I am repeated when we're talking about the diseases, infection diseases, high risk infection diseases. Yeah, it's very, very important. Thank you, Ayush, for your question. It was very interesting.
Thank you so much. We have one more question from Joanne, if I'm pronouncing it right.
Yeah,
You
you're
can go ahead.
pronouncing it right. Yes, thank you so much, Nandini. Hi, doctor. First of all, I would like to say that your session was actually very insightful. There was a lot of things I did not know because, as you know, social media, they spread a lot of, rumors like brace yourselves for the next lockdown.
Misinformation. Yeah? In social media, you'll find a lot of misinformation. Yeah. So
Yeah, and
this is very, very important when you find evidence information, guys. Yeah, evidence information.
exactly. So, your insights were actually very informative, and I would just like to ask you this question. So, basically, so now that this virus has been recently discovered and its distribution is it's just in the starting phases. So, if you could prioritize, if you were to start researching and set out for helping the network of researchers for this virus and helping a better response for the research part of it. If you could prioritize one area of hantavirus research for funding, what would it be and why?
One most important, and during the lecture I am highlighted, this hantavirus, it's very different from COVID-19 infection and other respiratory infection, because respiratory and other aerosol infection diseases characterize very rapidly transmission. They are transmitted very rapidly, yeah, aerosol infection diseases. But these types of infection diseases, I mean, hantavirus and Andes hantavirus, especially Andes hantavirus, because other types of hantavirus don't transmit it from humans to humans. They don't have those possibility. And based on this, we can see in the future, we don't have any negative, we can see, evaluation. And we can see strategy evaluation of this process, we can say, yeah? Because only Andes hantavirus have the, we can say, specific characteristic with the close contact transmitted from humans to humans. And other types, no. And based on this, we don't have any problems and any, we can say, dangerous situation. Yeah, it's something different, yeah, from COVID-19 infection. But in addition, it's very, very important in addition, yeah, because as I mentioned at the beginning of our lecture, one most important, and you mentioned this, is when we're talking about something, yeah, important is evidence information. And for professionals, medical care professionals, what is this evidence information? Indicators, yeah, healthcare indicators, vital indicators, and diseases occurrence indicators, yeah. And the diseases occurrence indicators, this is a case fatality rates, mortality, economic loss, morbidity, all these indicators, and finding a calculation of associations between exposure factors and diseases for the finding of evidence information, yeah? And evidence information helps decision makers through the implementation of evidence-based public health intervention, yeah? And always we should be find statistic, evidence information, and consider and sharing this evidence information to the audience. Yeah, this is a very, very important. This is a very, very important.
Thank you so much for answering that question, ma'am. That's it for now. Thank you.
Thank you so much. We have another question from Ali. Go ahead.
Okay. First of all, I want to thank Dr. Nino for the amazing and very insightful session. I actually tried to learn a bit about the hantavirus before the session, but you made me realize that there is much more to learn because it was very insightful and full of information. I would like to take a permission from you and from the moderators to know the amount of questions I am permitted to ask, because I have a couple of questions in my mind.
Professor, if you have time, you can. Is it okay if he asks like multiple questions? You have time, right?
Multiple question, what you mean?
Yes,
Maybe two questions.
Oh, he has two questions.
Okay, it's okay.
All right, okay, go ahead.
Okay. Okay, my first question is that I believe that the mRNA vaccine technology emerged and actually advanced much more after the 2019 COVID-19 pandemic. And as much as we know about this technology, it mitigated the burden to reach a vaccine for each and every disease that we should encounter. So I want to know, uh, why doesn't that apply for the hantavirus? Does it like pose an extra burden for the mRNA vaccines? Because I can't imagine the way that makes it difficult to develop a vaccine at this stage for the hantavirus, even from 1 or 2 or 3 cases.
Ali, thank you very much for your question. But unfortunately for hantavirus, we don't have any vaccine. We don't have vaccine. I mentioned, and in addition, we don't have any specific treatment for the hantavirus, and this is the challenges. Doctors treat, and during the lecture, I am highlight special slides I am put in my presentation. We don't have vaccine, and in addition, we don't have any specific treatment. Doctors treat symptomatic, based on symptoms. And based on this, we have a lethal outcome. Based on this, yeah? Based on this, we have challenges, yeah? In another way, this is for the hantavirus. But in general, when we're talking about the vaccine, yeah? Vaccine is one most important achievement in medicine. When we're comparing benefits and harm, vaccine is more, from the vaccine, we have more than benefits than the harm. It's evidence, it's so. And another way is, and problem is it, when all countries in the world have availability to the vaccine, because we have a lot of countries, low, middle-income countries, who don't have some vaccines, such as, for example, HPV vaccine, which is very important for the prevention of cancer, yeah? And it's very, very expensive. And equity and disparity, again, vaccine and vaccination, this is the biggest challenges nowadays when we're talking about the ethics and medical ethics. But for the hantavirus, we don't have vaccine. We don't have vaccine, and we don't have specific, we can say, treatment. This is. And what was your another question?
Thank you for your answer. My other question was, what did we learn from the COVID-19 pandemic and we are doing differently now? Do you think the WHO is more confident by combating the emerging pandemic right now?
Yes, we learn a lot of, and one most important what we learned from the COVID-19 infection, when we improve our international regulations according to World Health Organization. I mean, risk preparedness and risk communicational plan, strategy plan, for the high-risk infection diseases. And during the, maybe you don't remind, but during the, at the end of the lecture, I'm sharing of my presentation. In my presentation, I put main important objectives from these international regulations and recommendation from WHO. And one most important, what we learned from COVID-19 infection, disease objectives from One Health, that multi-sectoral collaboration, implementation of preventive measure to the animals, to the environment, and to the humans. Because nowadays, improving and improving in international regulation of World Health Organization preparedness plan, I mean strategy plan, One Health, preparedness and One Health, we can see topics. This is the one most important, we can see, achievement what we are learned from COVID-19 infection. And in addition, very important is just now I'm saying disparities with vaccine. Disparities, yeah. It was very biggest problem when we're talking about the COVID-19 infection. And in addition, preparedness of healthcare workers, in addition, which very, very important, improving professional skills of doctors, enough equipment for the medical person, which is a very, very important, implementation of infection controls guidelines, yeah, for the improving of law and regulations according to infection controls. It's very important. All this, we can say, factors we learn from COVID-19 infection, yeah? So we are improve, for example, in Georgia, we are improve our strategy plan about the preparedness of pandemic and risk communication, which is a very, very important. And in addition, Georgia every 2, 3, and every year started training campaign, training for the medical person for the improvement their professional skills of infection controls, which is a very, very important. In addition, when we're talking about the hospital-based infection diseases and patient care.
I do have a quick question. Can it be transported by pools?
I'm
Like
not
swimming
understanding
pools?
what you mean.
Like
I'm
swimming
not
pools?
Please repeat your question. I'm not listening your question. Please.
Yeah. My question is, can it be transported by pools? Swimming.
By the swimming. By the swimming. No, it's not transmitted by the swimming. It's not. As I mentioned, one most important when we're talking on the transmission of hantavirus is rodents and in close contact with rodents, and when we're talking about the and this virus, close contact with rodents, and in addition with person who have those symptoms from saliva and etc. Not from swimming and etc. No.
I have a question. Can I?
Yeah, go ahead, Monish.
Yeah, so I wanted to ask if we can provide intubation or oxygen mask as one of the form of therapy for them.
I'm not understand. Please repeat your questions. What
Like,
about your...
can we provide intubation or oxygen mask therapy for them, like for people who
oxygen
are...
mask therapy? Yeah, oxygen mask therapy. One most important, we can see tools in the treatment process, and during the lecture I am highlights this. Yeah, but this is for the some types. This is a hemorrhagic cardiopulmonary syndrome. This for these types of hantavirus infection diseases, because different infection diseases, hantavirus infection diseases, have different, we can say, treatment. Why not? Because specific treatment we don't have. Yeah, we doctors treat specifically on the symptoms. Yeah, and oxygenotherapy it's involved, but specifically for the cardiopulmonary hantavirus infection diseases.
Okay, thank you.
Yes, Joanne, go ahead.
Ma'am, just one more question. So, according in your perspective, what gaps still exist in our understanding of hantavirus pathogenesis, and what is the gaps in the research as well? Like, what are the gaps in both research and the understanding of the hantavirus pathogenesis?
what is the gaps for hantavirus? One most important, biggest gaps when we are talking for the hantavirus is that it's hantavirus have we can highlight that it is an endemic virus, and it is characterized by some countries, yeah. And always when we are talking about the investment and investigation of outbreaks that is related to the hantavirus, important is epidemiological history, travel history, yeah. And just just now we are talking about the trips cruise outbreak, yeah, but just now in this example for epidemiologists, important role made travel history, epidemiological history. This ship was started, joined their cruise from Argentina. And Argentina, this is an endemic countries for Andes hantavirus. Yeah, because all respiratory diseases have the same syndromes, yeah? Vomiting, diarrhea, fever, muscle meeting, and etc. Yeah, muscle ache, and etc. Yeah, but important is here epidemiological history, yeah, epidemiological and travel history, which is very important for the differential diagnosis, we can say. And yeah, biggest gaps is that all respiratory diseases and all hantavirus have the same symptoms that COVID-19 infection and other respiratory diseases. But important is when epidemiologists, investigators, and researchers focusing on the travel history and epidemiological transmission.
Thank you so much. Anybody has any more questions, or can we wrap up? Okay, going for 1, 2, 3. Nobody has questions? All right then. Thank you so much, doctor, for this session. This was
Thank you.
amazing. It was much needed currently with what's going on. Thanks a lot. We learned a lot. Yes, Ali, go ahead.
It was an error. I didn't raise my hand.
I'm not here. It's a bad connection from internet.
Can you repeat again?
I think he said it's by mistake. Yeah, by mistake.
Okay, all right. Okay, so thank you so much. Have a great day.
Yes.
Thank
It
you so
was
much.
very pleasure. Thank you very much for your attendance and participation. And I think in the future, I have more than possibility working with you.
Thank you so much. It means a lot.
Bye.
Thank you.
Bye.
Bye-bye.
Bye.